A new, highly contagious variant, the Omicron variant, is now considered a very high global risk by the World Health Organization.
We shouldn't need another wake-up call. We should all be wide awake to the threat of this virus.
The variant, first reported to WHO on November 24th in South Africa, has now been found in Belgium, Botswana, Germany, Hong Kong, Israel, Italy, and the United Kingdom, with more countries reporting detection daily. Omicron is already labeled a variant of concern, meaning it could be more transmissible and possibly more virulent.
When you look in South Africa, you were having a low level of infection, and then all of a sudden there was this big spike. And when the South Africans looked at it, they said, oh my goodness, this is a different virus than we've been dealing with.
Early research suggests this variant is highly contagious, with more than 30 mutations on the spike protein. And this is important because the spike protein is the part of the virus that binds to the human cell, causing infection. With more mutations on the spike protein, there is a higher likelihood of transmission and more ways for the new variant to possibly evade immunity. It's still too early to determine the severity of symptoms. The COVID response task team told the president it would take 2 weeks to have more information on this variant. But experts agree the vaccines still work.
When you get a level of protection with vaccine, and particularly now with the extraordinary increase in protection you get with the booster, even when you have variants of concern, you do well against them.
Because it is still so early, we can't determine if the variant is here in the United States yet, but given how transmissible the new variant is, it would not be surprising to see Omicron detected soon. The U.S. has already restricted travel from South Africa and 7 neighboring countries.
The issue of blocking travel from a given country is to just give us time to assess it better.
The one thing everyone can still do is get vaccinated. And if you're eligible for the booster, get that as well. That means 6 months or more from the second dose of an mRNA vaccine, either Pfizer or Moderna, and 2 months or more following the single dose of the J&J vaccine. And both the World Health Organization and CDC's guidance is to practice social distancing, hand washing, good ventilation with something as easy as opening up a window, and masking up.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.